Kenny Bramlett. I'm an orthopedic surgeon in Birmingham, Alabama, and what we're doing is showing some information about common orthopedic injuries. So I'll graphically show you a detail of rotator cuff disease or pain, rotator cuff pain. So if we look at this, we're going to start off looking, this is the clavicle, okay? Let's assume this is the clavicle, say your left shoulder. All right, underneath the clavicle is the humeral head, and the humerus is humeral head, which articulates with the scapula, okay? Scapula, okay? And again, this is the humeral head, right here. All right, so a rotator cuff, what really a rotator cuff is four muscles that come to the top of the shoulder, kind of like a baseball glove, if you will, but they're attached not only to a ball, but a ball and a stick, like this. So they're represented by these blue lines, which are the muscles, which come off the rib cage and the scapula to the humeral head. So when you pull on these muscles, the arm obviously can go up like that, okay? So what happens over time, people get developmental irritation and inflammation, and the clavicle, from wear and tear, pulling and tugging, it'll develop some arthritic changes across the capsule. Also, the acromion will grow fibrotic calcification. It's what we refer to as spurring a lot, okay? And there's a ligament that goes across, over, also to the scapula, which is a coracoacromial ligament. That ligament in some people is very wide and broad, and it calcifies over time. So every time you raise your arm up, this is rubbing on it. That rubbing causes irritation. That irritation occurs in this area here. The irritation causes pain, and the rotator cuff becomes threadbare, just like crawling around on your knees on a pair of pants, like a 4-year-old. Over a period of time, it just get threadbare when you squat down, or you pull up on something, a suitcase, or lifting objects, or using overhead tree trimmers, which we see all the time. Then it'll get a hole, and that hole is a rotator cuff tear. It takes some time to wear into that chronically, unless you have a very acute injury like a bad fall. So what happens is, the treatment for that is to take the bone, which is here, and take that bone away with what we call a subchromic decompression. So that goes away. So now you've got a significant space here that wasn't there before. So now every time the arm raises up, it rubs against nothing, because right now it's rubbing hard over a period of time. And that's what causes a rotator cuff. It's, quote, impingement/tear. So the idea is to catch it before it becomes prolonged, because you catch it early, you take off the spur, and the rotator cuff, before it's abraded and gets thinned, then it won't tear. So we do that all the time, and that's the most effective way to treat it. Catch it before it tears apart. After it tears apart, obviously you have to have rotator cuff surgery, which requires an arthroscopic tacking, sutures, all the things of that nature, and a prolonged recovery. Most of the time, if you catch it early, it's in a sling for a day or two, out of the sling, back to work in 2 or 3 days, and on about your business. That's a very effective way to treat it. So that's a kind of a quick update and a drawing of how rotator cuff develops and what goes on to it.